I've been in practice since 1994, since I came back from a training in Hong Kong. As the name suggests, aesthetic and reconstructive surgery. So what this means is that we have patients as young as teenagers who have a developmental growth abnormality with the jaw maybe longer, shorter, and we can do corrective surgery to harmonize the face, so to speak, and all the way to the more mature members of the public who may have lost some teeth or may have shrunken jaw due to aging and atrophy, and we can rebuild the jaws and the teeth using advanced technologies. We invest heavily in modern technologies in order to achieve a better result in a shorter time with less pain and swelling. Using all these new technologies, we're able to achieve good results in many of our patients. Traditionally, we depend a lot on CT scans, and we always send them to an X-ray clinic to get a CT scan done. We sometimes may have a scan more than one time in the course of one treatment. So the conventional medical CT has a rather high radiation dosage, and it's inconvenient. We need to make appointments for patients and all. So we made the decision to actually invest in our own CT scanner. This is a cone beam CT, and what it means is that we can reduce the radiation dosage to the patient significantly, and that allows us to have a very clear image of the skeletal structure of the patient without actually having to send the patient out. And we do not need appointments, and we get everything done in-house, and it saves time and it exposes the patient to less radiation. Another advanced technology that we employ is use of simulation software in planning facial corrective surgery. So in this case, what we can do is to try out different surgeries on the bone, and then it will be reflected on the patient's photograph that is mapped onto this CT scan. And we can try different procedures and let the patient see what kind of result they can see on the face. So the advantage of this technology is that the patient will then be able to have a mental picture as to roughly how he or she will look like before embarking on the surgery, and will actually have a choice and participate in the decision-making process, as in, like, do I want my chin to be in this position or my upper teeth to be in this position, and do you want it a little bit further back and further forward? And so it's a discussion process, because my idea of aesthetics may not be the same as that of the patient, and ultimately it's the patient's choice that matters most as to what is the ideal aesthetics for him. And my job then is to tell him whether is it possible medically to achieve that kind of results using this kind of simulation software, and it's a good communication process so that we have established a common understanding as to what is the end point that we're trying to arrive at. This is one of the advanced technologies that we employ in the management of our patients' conditions. And what this machine can do is that it will concentrate growth factors from the patient's blood, and then we apply it to the wound, and that helps in the healing process. It speeds up the healing process, and it makes the patient has less swelling and a better recovery. In addition, it can also concentrate bone marrow cells that we harvest from the hip. So in the old days, we have to actually open up the hip to take bone. So now with this machine, all we need to do is to insert a needle in and draw out a bit of the bone marrow cells, and the machine will concentrate them, and we'll get the same, if not a better result than actually taking blocks of bone from the patient's hip. Hi, I'm Dr. S.L. Chan from Aesthetic and Reconstructive Jaw Surgery here in Mount Elizabeth Medical Center.